thank you everyone for joining. I hope you guys had some really great discussions in your concurrent sessions and enjoyed learning more from each of the panelists there and doing a deeper dive into what was happening. I recognize that we are running a little bit late and running a little out of time. So I think what I'll ask for first is just what I want to end the sessions on today, and I'll see if there's any participant questions, but I really want to end. I mean, I live in Washington, D.C., and it has been a difficult year 15 months for a lot of Americans, and I think Canada is also feeling some of the effects of what's happening in the United States. And I really want to mend on a message of hope. My favorite part about being in planetary health and my favorite part about working in this community is that planetary health really likes to center hope and collective action and this idea that, we are fighting for a better and a greater world for everyone. And so with that, my question to the panelists or whoever would want to speak up is kind of what is the main message of hope or main takeaway, positive takeaway that you want to leave the participants with after these great hours of conversation? Kind of what is that takeaway? What is that positive note? And I'll let anyone answer, whoever wants to speak up, and start from there.
I'm happy to open us up in conversation about this. Um, what gives me hope and allows me to see the vision of that possible future that we feel is really like the innate knowing that at our core we are loving beings, and we all here on this call are nurses or health professionals or midwives or nursing students, and we get the opportunity and the privilege to do that for our work. But at the core of it, it's really this act of caring and respecting life, returning to remembering this role that we play as stewards and caretakers. And I see this happening all over the world in all the different spaces that we are right now, especially I'm in South Minneapolis, Minnesota. And obviously, the global community is aware of what we have been experiencing with the immigration enforcements and the impact that that's had on our community. And to see a collective of hundreds and hundreds of thousands of people overnight build a mutual aid network. There is nothing more inspirational to me than that, to see that, wow, humanity still has that level of human intelligence and capacity to care for each other, care for your neighbor, care for the land without knowing who we are. And even the social networks that we had to utilize to build that infrastructure, to watch it in real time go from global, these big neighborhoods all on a channel, to, oh, this is too big, we have to scale it down a little bit for our capacity to really care for one another. Oh, still too big, we need to get down to just a couple of blocks. Oh no, just our street. And it's like this hierarchy being dismantled in real time. No one knows each other's names. It's just, here's the help we need, and someone says I can do it. And to be living through that with my community right now has completely, changed me and shifted my perspective in this moment of time, to live in that place of hope that we are possible of we are capable of deep care. So
Thank you, Angelica. I really resonate with that and think living in DC too, seeing how the community has banded together has been really important. Would anybody else like to speak or add anything?
That was really nicely expressed, Angelica, and what lovely words. And I think that sense of community, that sense of coming together, the sense of in a world that feels very individual. Actually, we all individually are connected to each other and the earth and the animals and the air and the water. And this movement towards truth and reconciliation and embracing indigenous knowledge and ways of being. I think that's what really stands out to me in many of the presentations today and other planetary health work. And I agree. I think it can be very dismal living in the world of planetary health and feeling like the failures. How many more COPs can we have? How many more IPCC reports can we have? How many more, government failures or feeling like it can we have? But actually, is it the people that, is going to save things in the end? And I think the other thing that came through strongly, Angelique, is that we can do this. And that came out in the pandemic. Collectively as a society, we can do pretty amazing things overnight. If the collective will is there, it is possible. And I suppose the hope is that we are able to do that and to move things forward, particularly in nursing and healthcare.
I would add just punctuation and say that I actually live in a world of solutions. That's what I see. I see it every day. I see it all the time. I hear about it from across the globe. I see it in front of me. I talk with people day in and day out about it. So I am I have no doubt that we can, I say we can, help nourish and create the kind of world that we see that is important. It is the world, because like you said, Heather, the natural world, for instance, is moving along. We can learn a lot there and get replenishment. But I believe in our human world, we can too. And I'm heartened by seeing, yeah, there have been some storms, no question about it. And I know that some have been knocked off course, and I hope that all will, come back and share together in creating this better future. Got a lot of challenges ahead, but seriously, I do not feel failure of our world or us as humans or us in healthcare or us in nurses, because I see so much good and positive that's happening. Not to be Pollyanna-ish, but to not forget that that is a real source of strength as well. Thanks.
Thank you, Elizabeth. And just for Julie's sake, we're answering the question right now about your main message of hope or your main positive takeaway you'd like to leave participants with. Oh, I can't hear you, and I'm not sure.
Sorry, I had turned off my external microphone. I think my main message of hope is, even though I think right now things are a little challenging at the federal level, what we're finding is that we can make a lot of changes at the local and state level. And so that is where I find hope, is that I find that we can really make a difference locally or even with the state legislature, even when things are challenging federally. And those are really important moves to make. So that's it.
Thanks, Julie. I completely agree. The local solutions and kind of bringing it back to your community is really important. And Kamala, do you have anything you'd like to add?
Echo everybody. I also think, alike with Angelica, we are all filled with like sensibilities. What we are missing right now is just we're not slowing down to appreciate our interconnectedness with the natural world, to go within ourselves, to understand our deeper capacities, to love, to help, to work with compassion more. I think world will be a better place. We already have so many evidence that we've learned from so many people here. We don't need to reinvent solutions. We already know so many solutions already exist. It's just, I think, we need a little bit more reflection about our collective impact and how we can do this work together.
Thank you. Okay, I'm gonna see if there's any audience questions. Seeing none, I recognize we are 3 minutes over time, but we also started late. So what I guess is I'll say one more time, I think a lot of what I've heard today is kind of the actionable items and the concrete solutions that we can all take. And I wanted to ask, just my final question would be, what is that concrete action that you would say that nurses can take individually or collectively to make planetary health a visible part of everyday nursing practice and leadership? And I'll let anyone start, and then, yeah.
I can just say, I think one simple way is just to set a good example, personal example, and it might be everything you do. Refuse that single-use anything, whether it's a single-use water bottle, you go to the grocery store, no plastic, whatever. But I think setting an example is one simple thing we can do no matter where we are, is to refuse single-use items as much as possible.
And I would add, for people who do want to get involved, and not everyone does, but for those who do, there are many ways in. So I encourage people sometimes to figure out what it is that they love. What do they care about? Some people really care about food. Some people really care about bicycling. Some people really care about carbon, so start there and learn and talk and network and attend things like this and get to know Annie, and all sorts of things will come out of that.
Mm-hmm. Yeah, I'll echo on that as well, and also just add, let nature be your guide and your teacher. Everything we need to know. The knowledge and the wisdom is cycling within this ecosystem that we get to be a part of. So, kind of building on what Kamala said, knowing what that awareness practice is for you, so we're able to rest, restore, heal, pay attention, have intention, and devoting yourself to what that looks like for you in your life, with a sense of accountability and responsibility.
And I'll just circle back to that sense of community again. I'm just noticing people coming in and recognizing how many people I've known from various things over the years, and people I've not met before, but referenced you. And, what a fantastic community of nurses, midwives, our healthcare professional colleagues. And I remember feeling very alone in this Planetary House space, feeling like I was the only nurse who cared because I couldn't find anybody else who, in my little circle. And then actually finding, there's a lot of people out there that do, and finding your community, whatever that is, and doing things as teams and working together. And I think, collectively, there's so much power in everybody doing something makes a big impact, rather than trying to do all of it by yourself. So just that final thought on working together and finding our teams and team in the broadest sense of nursing. And what a fantastic conference this is. It's just, I mean, the program alone was just such an exemplar of people coming together because they really care about our patients and families, and because they really care about the planet. And those things aren't separate entities, they're interconnected.
Thank you, Heather. I'll see if anybody else would like to answer. Okay. We are 7 minutes past time, but I do see lots of panelists just joined, so I'll just pose a question to them really quickly. The question that we were all just answering is, what is one concrete action nurses can lead individually or collectively to make planetary health a visible part of everyday nursing practice? And if Kat, Mary, or Helen, if you'd like to join, or if you'd like to answer, or Gina, if you'd like to answer, and if not, then I'll pause.
Well, I would just like to say thank you to everyone who's doing this work. And it really is wonderful to know that we're not alone, and that we actually have this opportunity to meet each other. And, I don't know if I'm going to ever get to meet any of you personally, but I do feel now, I feel such a different sense of possibility of what I'm going to be able to do in this work because of the work that you're doing. And I just want to say thank you for that.
Thank you, Mary. And I think that might be a great note to end on. Oh, Gina, if you'd like to.
I was just going to, echo, what has been said. This conference has really been amazing. Just to have the reach that it had, and to hear from all of the experts. Many of whom I have met and worked with, and many who I have not. And I just thank you all for your work, and thank you all for the opportunity to be involved in this work. It is life changing. So thank you so much.
Thank you, Gina. Okay, with that and recognizing that we're a little over time, I'm going to wrap it up and thank you all for participating today and speaking. It's been really lovely being in this space with all you amazing nurses and clinicians. And I'm going to hand it over to do one more wrap-up video, I believe.
Hi, everybody. I'm Ray Harwood, and I want to thank you for attending our conference. This has been a really great adventure for you and for us,
Yes.
and we really thank you for being here. We have been a team, and I want to introduce you to the planning team, who is, without their help, this would not have been possible. I've taken care of some technical things on the back end. They are the ones that have really brought this content together for you, and I hope you've enjoyed it very much. I envisioned this entire conference starting a year ago, March of 2025, and it's really been great to see it come together with all of their help. And so I'd like to introduce you first to Diva Marie Beck, who has done a really great job. Many of our speakers have been in touch with you, Diva, and I look forward to hearing you.
Oh, thank you so much, Ray. And greetings to all of you. You've had a day of wonderful presentations, learning about planetary health and sharing your thoughts and participating and listening. And it has been a pleasure to be in support of you, coordinating with you, meeting you. It's been a pleasure from start to finish.
I am Barbie Dawsey, and I'm with DIVA in the Nightingale Initiative for Global Health and in Santa Fe, New Mexico, in the United States. And I just want to say right now, you're probably swimming with so many ideas. I sure am. And just want to say, nurture yourself, nurture your noble purpose after hearing all of these. And this is for all of you nurses and midwives. It is just such a joy. And take care of yourself. Really identify what do you want to do? And I also want to say Florence Nightingale called her work her must. So after this conference, what is your must? Heidi.
Oh, thanks, Barbie. Hi, everyone. Again, Heidi Honegger Rogers, also coming in from Santa Fe, New Mexico in the United States. I think what's amazing about putting together this global conference across all of these time zones around this world, especially, on the heels of the Artemis 2 mission, where we've gotten to see new images and to think about how nurses and midwives are coming together from everywhere to show up for each other, for ourselves, for the earth, for our communities. This is such an incredible community of people. This is us coming together, potentially this way for the first time, but certainly not for the last time. This is a movement. This is the future of nursing. We are here showing up for that work together, and it's been just an honor and a pleasure to work with all of you, all of the visionaries from around the world on bringing together all these stories and insights and wisdoms. Teddy Potter.
Hi, I'm Teddy Potter, and I come to you from the land of the Dakota and the Anishinaabe people in Minnesota in the United States. And it has been my great pleasure to plan this conference with the people you see on screen here, but more importantly, to see all of our experts from all around the globe coming in to share their knowledge and their expertise and skills with all of you. It gives me great hope to know that nurses and midwives are showing up because, in fact, I believe it is the only time things get done is when nurses and midwives show up. So again, it gives me great courage, great hope to see that we are building a movement. We are building an action. We are building a process to ensure a better future for all the world's children and grandchildren and people. So thank you for being here. This is just the beginning. Please look at our list of sponsors and see how you might be engaged with their work. There's a marvelous group of people who have sponsored this programming, and we want to make sure that you connect with them and learn how to stay part of this work. So thank you for being part of this bold adventure. We need you more than ever. Thank you.
Thank you.